So, hello everybody. This is Caetano Marquezini from Brazil. We are here to talk about the 16th IFSO Journal Club that will happen on January 16th, 2020, 2:30 to 3:30 p.m. European time. And I'm here with Dr. Daniel Schauer, and we're going to talk about this paper published on Annals of Surgery on January 19th about bariatric surgery and the risk of cancer in a large multi-site cohort. Hello, Daniel. Welcome. And this will be a very short, but I think intriguing conversation to make the folks come to see the real stuff in January. So, Daniel, the first question I'd like to make to you is, what makes this paper different from the others? What was the motivation, and how does it make it really this different?
Thank you. So, obesity is very strongly associated with several types of cancer, including postmenopausal breast cancer and endometrial cancer. And this has become an increasing problem worldwide as the obesity epidemic has progressed. Several studies have tried to address the question of, does intentional weight loss reduce the risk of cancer? The SOS study was one of the longest follow-up studies, but it was really underpowered to examine cancer as an outcome. Ted Adams and others in Utah have done some nice studies that are fairly large with good follow-up, but they haven't controlled for all the risk factors for cancer. So we wanted to utilize some of the data resources that we had access to kind of ask this question: does intentional weight loss reduce the risk of cancer, in a study that's adequately powered with adequate follow-up?
Okay, so there are some other interesting things, intriguing things about this study, is about how the matching was made. How did you match this population? How did you choose that? What was the method used to make it? It's very, we know it's very strong study with a lot of big cohort populations. How do you do that?
Yeah, so the key to doing a study like this is having controls that are comparable to your bariatric surgery subjects. So we started off by identifying those within the 5 study sites that we utilized from Kaiser Permanente. We found all the patients who had bariatric surgery. Then we excluded those who had a prior history of cancer, because we were going to look at incident cancer as our outcome. And we ended up with just over 22,000 bariatric surgery patients. Then to find controls that were comparable in their cancer risk, we electronically screened the 5 Kaiser sites, over 16 million patients, looking initially just for, we restricted them by age and by body mass index to get, a close approximation for the matching process. And once we pulled data on those potential controls, we matched them up in a 1-to-3 manner with our bariatric surgery patients. And it was a several-step process. We started by making a bunch of potential matches. So if you had the same age as a bariatric surgery case, then you might be able to match with that person. You had to match exactly on gender. Your body mass index had to be within 5%. And by doing it this way, we created about 8 million potential matches, where each surgery case was matched to anywhere from 1 to over 1,000 potential controls that matched them on age, gender, and body mass index, as well as study site. Then to pick the actual best control, we use the Elixir Comorbidity Index, which is it's a simple scoring system that takes a look at all the comorbid conditions a patient has and develops a score from 1 to 31. So we use that to calculate the comorbidity index for each potential match, and then match them to their closest comorbidity index.
So after all this matching, I believe you have very interesting results here to show to us. And I won't spoil the results, but I think in your point of view, will we be surprised with some things and other things won't get to us? Like I had the opportunity to read the paper, and it's very, very interesting. Some things related to sex, to age, and types of cancer. We know there's a correlation with 14 types of cancer today to obesity. So what can we expect in terms of surprises? I think we have a lot of them.
Yeah, so I think we were able to assemble a great cohort that we followed for up to 10 years. The average was just under 3 years of follow-up, and we saw a significant number of cancers in this cohort. And yeah, I hate to give away the results, but I think intentional weight loss does work.
Does work. This is something very interesting. And cancer is very something with big concern, and we know that obesity has really paper important on the development of this so sad disease.
Absolutely.
Yeah, we know that. Could you talk just a little bit about the incidence of cancer and obesity, just to end our conversation, to folks hear what we are talking about?
Yeah, so overall, what we observed in our cohort, in the control patients who were severely obese, they developed cancer at a rate of about 1% per year. So over the 10 years of follow-up, over 10% of our control patients developed a cancer.
So this is very big. So this is a big matter. Daniel, thank you very much. I think we made it. Anything we talk about from here, we're going to spoil our results, okay? And we're going to talk a little bit more about it next time on January 16th. I hope you guys will be there with us. And if you have opportunity to read the paper, make up questions, see the presentation, and I think it will be a very nice discussion on January 16th. I hope to have you all there. Thank you very much. Daniel, thank you very much.
Great, thank you. Looking forward to it.
Have a nice New Year for you guys at home, and you, Daniel, and all the folks that are hearing us now. Thank you very much.
Thank you.